One of the uh, attributes of the campaign in its early days and to this day that I've always thought was extremely important, and again, something that Bell was very tightly focused on, was having a very strong research base for whatever we did. This area of sort of reproductive health, understandably, has a lot of political passion associated with it, personal stories and emotion. And I think what the campaign did, and I again credit Bill entirely with this, is saying we get all that and we respect it. We are only going to be able to make a difference if we're firmly anchored in facts. It's not the only thing, but as David Hamburg used to say, let's begin by getting the facts straight. And so there was an emphasis from the very beginning about getting very clear on what good research, both in the US and in other parts of the world, have shown about reasons for unintended pregnancy, about contraceptive use, about its consequences for women and children over the lifespan, children, poverty, and so forth. But it had never been marshaled in the way that I think we were able to do with good, strong research leadership. Chris Moore at Child Trends made an enormous difference in helping us get the facts straight, and many other people. It's still tough to work in this area because there's a lot of emotion and politics associated with it. But you have to know what you're talking about in depth, or at least know what you don't know. And I think that in our early years, we worked very, very hard to make this an evidence-based effort and not just personal tub thumping.
That, thank you for that. I completely agree, and it brings up something else,
Yes.
which I think the campaign got right. And we were always good, I thought, at convening people, at literally bringing people together, oftentimes people who
hated each other,
did not like each other.
Yeah.
I wonder if you could talk about the importance of both the convening part of it and then the sharing part of it.
Yeah.
In other words, I never felt that the organization was proprietary about anything we did. When we learned, we share. We often brought people together to share that information, to discuss what we had learned, to make clear what we didn't still know. I wonder if you could talk about those two things.
Along with a strong emphasis on research and getting the facts straight, in the early days, the campaign also reached out to people nationwide to not just bring them in so that we could say we'd talk to them, but to learn from them. People have been working on these issues for a very, very long time in many different ways, in the health sector, in religious education. Even some nonprofits and businesses have been involved in this issue of helping families decide when, where, and if. And I always thought the convening function was very interesting. First of all, one invariably learned something. Lots of people had lots of interesting things to say. And we loved it when we met people who maybe didn't even agree with us in particular and would talk about it from a different perspective we hadn't heard. And we became, I think, as we went on, very wide open to different points of view. And I think we were known that we were willing to talk to people on both sides of the aisle, people from different parts of the country, conservative, liberal, people who had different points of view on remedies and so forth. And we learned from them, and I think they learned from us, because at the same time that we were learning from them, we were also beginning to generate material on things that seemed effective, different ways of even phrasing things that might draw people together. And I think if we had just sat amongst ourselves and our friends and relations and figured it out, it would not have been as powerful as just going around the country and saying, how do you see this? What do you think we can do? It was in this area rather unusual because the sides were sort of already set up and at war. We feel this way and you feel that way. We don't agree. We don't like each other and so forth. And I understand that. We thought we would try a more sort of open door, bipartisan approach. It was not always easy, but I thought it was very powerful, and we learned a huge amount.
That's great. That's great. Good.